A couple more folks jump on. Is everyone able to hear me? Yes? Okay, great. During our initial talk, everyone will be muted for clarity purposes, and then towards the end, we will open up the line for questions and answers. Well, welcome everyone. Thanks for showing up on time and being on time. Like I said, in about 1 to 2 minutes, we'll get started. We have significant amount of content to cover, which is my pleasure to share with you guys. We have a number of people coming on. We're going to start in about another minute with our session today. So I encourage everyone to grab pen and paper so that way you can take some notes, some of the things that I'll be sharing, some practical tips that you'll be able to definitely utilize. During the talk, you may want to jot down any specific questions that you may have an opportunity to share towards the end. I apologize to anyone last week who had a question that didn't get answered. I was learning how to navigate the chat box, so there may have been some questions that I did not see, but that won't be the case today. I'm sure we have folks from all over the United States and beyond. So welcome, welcome everyone. Glad you been able to join us today. My name is Fred Brown. Like I said, this is our second session, a follow-up to our first session last week. If you weren't able to make the previous session, be sure to revisit the recording. There will be some folks who will see this recording as well. But we have a ton of content today to cover, a ton of information that it's my pleasure to share with you that hopefully you'll be able to utilize, put into practice, whether personally or have information and resources to share with others, your loved ones and so forth. I also will get you connected to additional resources so that way you can continue your journey into preventing your health and also significantly improving your health, if you so choose to apply the information. Once again, I'm not a medical doctor. I am a respiratory therapist, but more importantly, a Buteyko specialist. And that will be the center and focus of our conversation today. Understanding how to, number one, apply some basic principles in Buteyko, why it's important, and as well, how can that impact what we're dealing with in our times presently, and that's COVID-19. How can that relate? How can that help or prevent us from succumbing to some of the difficulties that COVID-19 presents, as well as if you are sick with COVID-19 or any virus, bacteria, some things that you can do to help to promote your own health or the health of your loved ones. So once again, welcome everyone. Thanks for being here, showing up. Once again, some of the things that I want to address is that we should have, I'll just give you a little overview of the direction of our flow of our session today will be. We'd like to talk about some expectations that you should have with this course, so that way we all have some clarity, the purpose and the design of this course. Also how to avoid getting sick, and if you are, increasing your recovery time. Some practical tips we'll cover that you can utilize in your home, and also if you find yourself in the hospital. because I'd like to talk about some of the things that I've done in the hospital to help some of my patients. And these are some things that you as well can do if you unfortunately find yourself in the hospital, some things that you can do to help increase your recovery, quicken your recovery, as well as doing some things that you practically that you can do at home to avoid going to the hospital in the first place, even better. We're also going to talk about how all Buteyko methods are not equal and why that is, and sharing some of that information with you as well, which makes the breathing center different than others. We're also going to talk about some tools, resources, what you can utilize and get access to, so that way you can continue and improve on your health even beyond today. Let's see. And, what you want to do next. How do you want to take this information and utilize it and grow from it? And we'll also have a little period of questions and answers as well. So without further ado, let's jump right into the information, right into some of the topics that we highlighted. And that is our expectation with these courses. Many of us may have come and purchased this course with various expectations, but I like to give you maybe a sense of reality. And that is, this course is not designed to really replace the full education that we do provide, that we'll be talking about later, particularly level 1 training. And so it's not, I can't replace that, but we want to give some key foundational tips. So almost like I think of it like an appetizer. You're not getting the full meal for time's sake, because I can't condense a 8-week course into 2 sessions. But we want to kind of pack these sessions out as much as possible, as much value. And so think of it as an appetizer. Think of it as an appetizer can satisfy your hunger, but it's not designed to give you the full meal. And so, think about it like, if you want to learn anything, you can get the, quick tips that can address some immediate things, but not address the full course and the full, helping you to maximize the benefits of the information. So that's important to be aware of. But let's dive into some practical tips, which I'm sure many of us are here for. And in my training, I like to really separate these tips into 2 categories. One is specific actions that you guys can take, and also lifestyle changes. We find those are 2 key principles that, if you harmonize together, will have a synergistic effect. Things that you can specifically do, whether it be breathing exercises, and then also lifestyle changes. And so we'll talk about that, because they do impact and enhance one another. One of the tips we talked about last week was about proning. And that's a term that we use in the hospital, where when patients have difficulty breathing, especially with this COVID-19, we talked about last week, and these are things that we do to help prevent patients from going on ventilators if their oxygen level is low. We have them lay on their stomach, lay on their chest. And that's something that you can do, and from a Dr. Buteyko's perspective, is it helps to decrease breathing in this position, right? And I've literally seen, as I said, shared last week, where an individual was on 100% oxygen, and they were ready to get more advanced therapy because their oxygen was still low. And by just flipping the person and them laying on their chest, I particularly have my patients go to the top of the bed, so that way their head is a little bit at the top, of the hospital bed and placing a slight pillow, on the side, so that way they have a little bit more room and their neck is not so much cocked to the side where it could be uncomfortable, but they can lay on a little pillow or the edge of the pillow, so that way your head is more at a diagonal, and that way it's, in that position, it can be a little bit more comfortable, and they can, one, relax, rest, and also help the weight of their own body minimize their breathing. That's something, as I said, all these tips you'll see can be in some shape, way utilized at home as well as in the hospital. So if you find yourself in the hospital and with feeling a shortness of breath, this is not something that you have to wait for your doctor to order. This is something that you can just utilize and apply yourself and gain those benefits to kind of prevent from your health decreasing. And so that's one principle. And we talked about that last week, and that's like a specific action that you can take. Another, I would say, lifestyle change, and that is what we call, oftentimes our lifestyle promotes a level of stress and anxiety. Particularly, many of us may be latched on to watching the news or engaging in activity using social media. And you got to realize this can have an impact on your health. This can have an impact, as we all know, on your anxiety. And anxiety, stress, all are key components to ill health. And so really learning how to minimize the exposure to these unhealthy activities, mentally, physically, as well as creating anxiety. It's good to be plugged in with a little information, but the overstimulation will have a negative impact on your health. And so because media, social media, some people do gaming, watch movies. All these are stimulation, and unfortunately, we live in a society where it's normal, but it's an overstimulation, and it produces a lot of what's called dopamine, which is a hormone that makes you feel good, and why we can become addicted to news and media and things, where one of the lifestyle changes is what we call a dopamine detox. And I'll put in the chat box a reference to a video that will help you understand a little bit better about how you can have a dopamine detox and help you to decrease your anxiety. Let me put that right in the chat box so everyone can have access to it. Okay. So I just put a link there in the chat box, which is a link to a YouTube video that talks about dopamine detox. And I think you may find it helpful, but it particularly can help with anxiety, which I'm sure all of us are feeling. We don't need an additional anxiety and these things. So that's one lifestyle change that you can have, because one of the things in the principles that we teach, stress, we all know how stress is negative to our health, but we may not know how negative it is to our breathing. And stress and hyperventilation, breathing too much, go hand in hand. And why is this? I know we have many people here from different backgrounds. Some are familiar with Buteyko, some are not. So I'll try to, kind of cater to both audiences. But let me take, a step back and just sharing a little basic foundation so that those who are familiar can be reacquainted, or the key to learning is repetition. But those who are new can also kind of grasp, why are the things that we're talking about? Why are these practical tips? Why are they important? And how does it relate to improving our health? Well, one of the key principles in the Buteyko method is relax, decreasing our breathing and increasing the level of CO2 in your lungs. Why is that? Well, Dr. Buteyko, he didn't discover this, but he was aware of this, and that was a principle known as the Bohr effect. And for many of us, some people are facts checkers, which is fine. And but this is something that you can look up on the internet, and I will put this also in the chat box. Christian Bohr was a physiologist, and he made people aware of this concept, the Bohr effect. And so it's in the chat box. So you're welcome to look this up, the Bohr effect. And Dr. Buteyko, he didn't discover it, but he utilized these principles, the principle of the Bohr effect, to really significantly impact people's health. And in a nutshell, it pretty much speaks about how we all know how important oxygen is. I mean, that's the center of the focus of, when you go to the hospital, they're always concerned about your oxygen level, your saturation level. Many of you may have pulse oximeters, that either you use in the hospital or you use at home, right, to check the level of oxygen. Well, we all know the importance of oxygen. It's to be consumed and to get into our cells. That's the whole purpose of, our breathing system. But what we may not know is the connection between oxygen and CO2, how both are important. And this is what the Bohr effect addresses. What it's and I give a little analogies so that way we understand this. And that is, if you think about a school bus, right? A school bus is designed to take our kids from my home to the school and drop them off. Well, in your blood, you have what's known as hemoglobin, your carrying capacity of your oxygen, and it carries and holds onto CO2. Well, that bus is designed to take that oxygen, right, from your lungs and get it into your cells, deliver it into your cells at the end. Just like a school bus is designed to drop off our kids, at the high school or middle school or what have you. But here's the key. That bus that holds the oxygen, it can only release, it's proportional to releasing that oxygen into the cells, is proportional to the level of CO2. So I relate that similar to like the doors on a bus. If you have more doors on a bus, then more kids can be released quickly. But if you have less doors on the bus, well, very few kids will be allowed out in a timely fashion. And so your hemoglobin, as it is in your blood, carrying that oxygen, you need a certain level of CO2, normalized level of CO2, to increase the uptake of oxygen into your cell, or the release of the hemoglobin. Releasing that oxygen is contingent on the level of CO2 in your blood. And so that's a piece that oftentimes is not considered or focused on in your typical allopathic medicine. Whereas Dr. Buteyko, who was a medical doctor, also a gynecologist, also a physiologist, an inventor, he used these concepts to significantly improve people's health. And this is what we're also doing, carrying on that work in the Breathing Center, helping impact people's health as well. Now, some of you have experienced this know what we're talking about, and some of you it's new. But the proof is in the pudding when you apply these principles over a period of time and you start to notice the effects. It can have a significant impact on your overall belief system. And that's what it did for me. As I said, I've been a respiratory therapist. Last week I shared with you, I've been a respiratory therapist for about 25 years. And even though when I was getting my training, a lot of the information was counterintuitive initially, it made a lot of sense. And when I started to apply it to myself and to my patients, I saw a significant impact. I'll share one with you. Recently, there was a gentleman who was COVID-19 positive. He was making some progress, but he still was needing a certain level of oxygen. And as his oxygen level was decreasing, I shared it with him. I said, and this is another principle that you can apply to yourselves, but I'll share with you how it impacts this person. I shared with him, it's important that you, one, breathe through your nose and focus on relaxation, decreasing your breathing, because he had a lot of noisy breathing at the time because he felt a little shortness of breath. But I assured him, I said, it may sound counterintuitive, but if you do this, you're gonna feel better. Well, lo and behold, he did apply it. When I went to see him again, I asked him, how's he doing? Are you doing the nasal breathing? Are you doing the relaxed breathing, decreasing your breathing from noisy breathing to light breathing? He said, I felt, an hour or two, I went back to visit him. He said, yes, I feel much better, and my breathing is much more comfortable, and you can see in his face that he was much calmer, much more relaxed, because noisy breathing also promotes anxiety and stress. And anxiety and stress also causes noisy breathing. And once again, what I mean by noisy breathing is, rapid, deep breathing, So it's a vicious cycle that many of us may not realize how we have significant control much more control over our breathing than we think. And so just by me giving him this instruction, he was able to relax his breathing and feel much better and actually be prepared to get discharged out of the ICU. So if these principles are able to work on the sickest of the individuals who are positive, think of the capability of those who are not at that stage. And so it's going to be that much more powerful and that much easier for you to apply. So that's a key principle. There's a lot of folks jumping on the bandwagon these days talking about CBD oil and the benefits of legalizing marijuana and things of that nature. Well, that's not something I'm here to speak about, but I am here to say, instead of focusing on CBD, I'd say practice LSD, right? And notice, I didn't say take LSD, I said practice LSD. What is that? That's an acronym for the L meaning light breathing, S being soft breathing, and D being deep breathing, right? So LSD is a way that you can apply when you think about how to breathe in a healthy way. Light breathing, instead of heavy, when we're sick, when a person is sick, they usually demonstrate the opposite, not light breathing, but heavy breathing. So healthy breathing is just the opposite. Very light breathing, almost like invisible, right? Soft breathing, instead of being, deep and hard, make it soft. And D is for deep breathing. And what I mean by D, sometimes people get the wrong impression. Deep means big. No, deep just means focusing on allowing the air to travel deep down into your lower abdominal area, where's your lower level of your lungs. So it doesn't have to be a large movement of your abdomen, which would be incorrect from this perspective, but it should be still focused on light, soft, but also lower in your abdomen, because you do have a certain area from your mouth to the bottom of your lungs that if you just do very little, we're not talking about little as in very shallow, there's a lot of dead space there. And so you want to bypass that this dead space by making sure that you get it deep, but it doesn't have to be big. So those are the sort of like the little details, distinctions between what you may typically hear about healthy breathing and from Dr. Buteyko's perspective. Because one of the things that whenever I bring up the topic with folks about breathing, they typically may have the false assumption that, yeah, I know how to I know how to breathe healthily. You know, yes, deep, you know, they always say in through your nose and out through your mouth. And from this Dr. Buteyko's perspective, that would be incorrect. It should be in through the nose and out through the nose, not in and out through the mouth. You will typically hear that consistently, but I'm sharing with you, try it, you'll like it, you'll notice a difference. You want to lower the amount of your breathing, and when you breathe out of your mouth, you're able to breathe a lot more volume than you should. When you breathe through your nose, just think about it. The diameter of your nose in comparison to your mouth is significantly less. So when you breathe out, it supports the light, soft concept of breathing as far as volume. We want to not blow off too much CO2 in our lungs, because we spoke about it earlier, because of the Bohr effect. We want to make sure that in our body it has a reservoir of CO2 to draw from, so that way we can actually maximize and increase the uptake of oxygen in your lung, throughout the cells in your entire body. And by doing that, how does that impact our health? It helps every system in your body become more efficient. And that's why CO2 was considered not a waste gas, but from Dr. Buteyko's perspective, the main regulator for every system in your body, because it can increase the uptake of oxygen in every cell. So because our organs consist of cells, if you have a more increased uptake of oxygen, and if that system is working more efficiently, therefore that's how it's going to impact your overall health. Whether you're talking about your immune system, whether you're talking about your cardiac system, whether you're talking about mental clarity. So it goes beyond just our lungs and the improvement of our lungs, and having the right amount of oxygen. Really, it goes beyond that, and really overall helping to improve every system and making your system more efficient, including your immune system, so that way you can have an improved defense mechanism against COVID-19 from a prevention standpoint. So you can have, if you do have COVID-19, you can maximize and improve your health as you battle through those symptoms, and quicken your recovery time. As I shared with you last week, I felt that was the case with myself. Having COVID-19, having those symptoms. By the way, I did do my antibody test, and I'm still waiting on the results to confirm that I was exposed. But with that said, I had all the classic symptoms: the significant cough, the fever of 103, and headache. And what I did was, at home, rested, took some days off from work, focused on my breathing, focused on relaxed breathing, focused on nasal breathing, increased my temperature by making sure that I was warm, so that way my maximizing my ability to improve one second, maximizing my ability to, for my own immune system to kick in. I also am a believer in taking garlic, because garlic is a natural antibacterial, antiviral, antiparasitic herb. So I took fresh garlic along with that to support my immune system. Just taking a clove of garlic and chewing a clove of garlic with some meat or some vegetables. And because it does have a strong bite, and sometimes people that can be fairly sensitive because it's spicy. And I took like three cloves of garlic per day, along with relaxation, along with taking a break, because relaxation and taking a break and chilling out for a little while is key to helping so that your immune system can focus on addressing the key issue instead of trying to run and then wind up having to go to the hospital. So those are some key points: rest, relaxation, taking some supportive things such as natural things. I recommend garlic, but the most important thing is focusing on your breathing to maximize the uptake of oxygen and increasing your immune system as well. And laughing a little. Oftentimes the lack of stress is an indication of, combined with the lack of, being happy, focusing on, laughing. I'm sure we've heard that laughter is the key to health, right? It's one of the most important forms of medicine. But does anyone know why laughter is a key component to our health? Anyone like to raise a hand and share why is it so significant and can improve our health? Anyone like to raise their hand and make it a little interactive, share with the group? Why do they think laughter is a key component to improving one's health? Go ahead, share with them.
I guess because in laughing, you exhale long, so you inhale less, and that way you do hyperventilation.
Well, thank you for sharing. That's, well, hyperventilation is something we don't want to do. So hyperventilation would be promoting, not improving our health, but lessening our health. And so when I say laughter, one of the reasons why, I say that laughter is one of the significant things to one's health. It improves your mood, and we all know that. But I oftentimes share with my patients, ask them the same question. I said, why is, laughter one of the most key components to our health? And one, it puts us in a state of more relaxation. It puts us more in a state of a happy place, And these are ways in which another principle we want to share is another tool that we use in the Buteyko, the Breathing Center, is using imagination to promote relaxation. As children, we were very used to, we're oftentimes used to using our imagination, right? It was easy to think about, playing with your dollhouse or G.I. Joe or making mud patties. We had the ability, to really tap into our imagination. But as adults, we tend to have lost that ability because of the hustle and bustle of life. But your mind, in order to relax, it oftentimes has to latch onto something. And so that's oftentimes why sometimes we have a difficulty in relaxing because we're so busy in our heads. But one of the principles that we teach is that through relaxation and visualization, visualizing helps to lock the mind onto something And that visualization should be not focused on negative news, but should be focused on something that brings joy and happiness to your life. Maybe a certain place that you think of. And in fact, we spoke about tools. I want to share with you this tool very quickly. I'd like to share. Okay, at the Breathing Center, we have available a CD that helps to give you that, you can, on an audio, you can listen to. It helps to, when you meditate, when you want to relax and focus on de-stressing. This is a tool that you can purchase at the Breathing Center. It's relatively inexpensive, that you can listen to and will help you with your relaxation, which from this standpoint that we're talking about, help you to increase your level of CO2 and also help to decrease the level of stress and anxiety, from the negative news, from and so forth. And so keep this in mind, but we'll talk about another opportunity, another way that people can get access to this towards the end. But I just want to share this real quick. Okay, so back to the topic at hand. Okay, so another thing that we can do is where okay, we're gonna, 1 second. Can you hear me now? Check 1. Okay, good. Thanks. So we want to talk about another practical principle, a specific action, and that is wearing your mask. People are focused on wearing their masks. My focus is using your mask for a different purpose. If you do wear a mask, you can use it as your Buteyko exercise, because once again, it's going to help decrease your breathing. But the important thing is breathing through your nose underneath your mask. Now, it will promote, maybe it'd be initially a little uncomfortable because you're not used to it. But once again, it's an exercise. It's a simple way where, hey, if you have to wear your mask or choose to wear your mask, that's one way where you can allow it to and help to now use it as an exercise to improve your health, to help you focus on 1, your breathing, so that way you have a greater awareness, and 2, help you to practice nasal breathing, even though it may be a little bit more difficult. So that way when you're not wearing your mask, it's that much easier to breathe through your nose, so forth, and along those lines. Now, sometimes people may say, well, I have a deviated septum, or I have other issues. Well, from this perspective, it's really the reverse. From Dr. Buteyko's perspective, your deviated septum, your congestion is as a result of not nasal breathing. Consistently mouth breathing, that's actually your body's defense mechanism of trying to decrease your own breathing. And so when you start to reverse, and maybe initially, for depending on where you are in your health journey, it may be more difficult than others. But if you start, you can start to decrease those symptoms, even if those symptoms are a deviated septum. Just work with your body, and you may not be able to do it for a significant length of time initially, but just work with your body, practice these principles, so that way, as they say, if you don't use it, you lose it. Well, because you haven't been using your nose, your breathing properly, oftentimes we have these symptoms. But when you start to use it, either shorter initially, if need be, and then increase that time, increase the amount of time, then that would be a way to kind of turn the table, uh, you know, and 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 allow things to adjust and change. And so you can, even though if you do have these issues, you still can practice something to get little results for greater results later on. Uh, as I mentioned last time, even if it's significantly that difficult, then there are some things that you can do to help support that as well, whether it's speaking with your doctor, with using steroids for a short period of time for a specific purpose. Dr. Buteyko was open to that and utilized those principles for those who fell into that category, that their nasal passages were so congested that they couldn't even start the practice. There were some things that you can do. From a natural standpoint, there are some natural herbal products that you can take to help support, known as Trikatu. That's another natural thing that you can use to help increase and open up your nasal passages. So you're not at a total loss if your nasal passages, your respiratory system is compromised. There are still some things that you can do to make progress. All right, and so these are just continuing on some other things that you can, practical things that you can do, and that is start, as you're doing your dopamine detox, well, that provides you opportunities and time for now taking a walk, engaging in some low level of activity, because that's another key principle of increasing one's CO2. Helping to decrease your symptoms. I'll share another example in the hospital where there was a young woman who I was seeing in the hospital, and she had a significant cough. She was constantly coughing. Now you would say, Fred, I can't do this breathing stuff, with a chronic cough, and maybe some of you, have a chronic cough. Well, what I shared with her is first start, as I'm sharing even in this session, start with doing something than nothing. And I asked her to start slowing her breathing down, focused on nasal breathing. I asked her to focus on relaxed breathing. And within 20 minutes, I went back to visit her in her hospital room, and she was no longer coughing. So by her making these adjustments, she had a chronic cough, which is a symptom from Dr. Buteyko's perspective of your body trying to decrease your breathing in an alternative way because the individual is not. But then once you start decreasing your breathing, you notice that those symptoms will dissipate because your body doesn't have to resort to those alternative ways of trying to decrease your breathing. That is really the perspective from this method, that really is a different way of looking at health and improving our health. Dr. Buteyko pretty much really was bringing to our world a different way of approaching health and addressing our health, a really new health concept. And so the results kind of speak for themselves. Moving on, trying to make this, utilizing our time most effectively, I'll continue and share some other principles that one can do also that can help with coughing or any related symptom that one can do in the hospital or at home. And that's what we call short breath holds. And a breath hold is basically just breathing, as we mentioned before, practicing LSD, right? Light, soft, deep breathing, but just breathing in. And then when you breathe out, you take and you hold your nose, trying to relax. And I would say hold it for maybe 2-3 seconds. You know, if it's difficult, because your health may be to a point where even 2-3 seconds is difficult. Well, that's okay. Do what you can. Just hold it for 1 second as an exercise, and do that consecutively. Hold it, and then maybe wait for a few minutes, a minute or two, 30 seconds, and do it again. And that's an exercise that you can do for, say, an hour. Do that alternating, holding for 2 to 3 seconds and relaxing, holding for 2 to 3 seconds and relaxing for a short period. If you're familiar with Buteyko, or a little bit more, your health may warrant, you may be able to hold it longer. That's fine. But I would say start um, doing short breath holds. And it's something, when you do a breath hold, you've done it too long. When after you release, you want to take a deep breath in, right? That means you've pushed your breathing too much. When we talk about changing our breathing pattern, everything should be done from a gentle perspective. It kind of like hits on the subject of what makes the breathing center a little bit different. And that is, one of the key principles is that may be different than maybe some of you have experienced other methods that have been taught, was you have to push your breathing. You have to uh, have a strong response in breath holding, and that's not something that we teach here, unfortunately. And I'll just touch base on this topic real brief, but unfortunately, the name Buteyko in this country was not, unfortunately, it was not protected. And so pretty much anyone can take that name, develop a website, or even if they may have gotten some training from Dr. Buteyko himself, but they not have been fully trained. And they're able to take that information, whether even someone today can just go create a website, slap the name Buteyko on it, and call themselves a Buteyko instructor. And this is why not all Buteyko methods are the same, and why people get varied results. Some people may still have been familiar with, or feel they're familiar with, Buteyko, but they're not getting the results that they're looking for, that we even speak about. Well, that could be a reason why, is because they weren't trained or by an individual who was fully certified. And they may have combined principles from Dr. Buteyko, but combined it with other information that they've had, and packaged it and labeled it as Buteyko. But that's not the same. All Buteyko, just be aware, is not the same. And so that's why I would encourage folks to stick with the original lineage, and that's with the breathing center, because in Russia, where it was originated from, they do have a patent on the name. There is more control, and that's where the advanced practitioners and founders of the breathing center have received and continue to receive their training and their support. And so there is a big difference, and that's why some people, even in our session, may be aware of why they have gotten different results. So just to share that, keep a little piece of that to really consider and provide you as some guidance. So another thing that you can do practically, and the question is, who should you rely on? How do you know? Once again, you will know. That's why I say, as far as guidance, sticking with the breathing center, and on the breathing center, they have a list of certified um, Buteyko practitioners. And so use that as a resource for your own research. So not talking is another principle, especially when you're sick, especially when you're having symptoms. I'll give you an example that will kind of demonstrate the power of not only the Buteyko method, but also combining it with not talking. You know, we're so used to being on our cell phones, you know, and people calling us, and maybe we you know, in the hospital even, you know, they're calling us and speaking with us. I recall there was a young lady who, she was an athlete, but she had significant problems with her asthma. She was in the ICU. She was wheezing, breathless, on oxygen, you know, requiring, you know, nebulizer treatments. And so once again, I learned this method to try to help my patients. And so what I do in the hospital is I try to, you know, fashion it in a way that, you know, in a way that, one, they can comprehend and utilize right then and there. So I noticed too that this young lady was also, even though she was breathless, on the phone. And so I shared it with her. I'd like you just to try this. It may be something different that you haven't tried before, but focus on breathing through your nose, relax your breathing, you know, LSD, and and take a break from the phone. Just do me a favor just for this period of time. And like I said, ICU, she was in intensive care. She was there because she had significant symptoms. Well, by the end of my shift, and this is not normally the case when you have a person who's in what's called static asthmaticus, you know, significant wheezing. Usually they're there for a day or so being managed. But by the end of the shift, she was being discharged out of the unit. Why? Because her breathing was much more controlled, and she did what I asked her to do. She did follow. She stopped speaking on her phone. She focused on nasal breathing. I didn't increase her medication, like oftentimes, yeah, frequency of giving her nebulizer treatment. I asked her just to focus on some basic principles that Dr. Buteyko taught. And like I said, before the shift was over, she was so well that she had gotten discharged and sent to a regular floor. So once again, these are just sharing these examples with you just to help you to wrap your brain around around how powerful your breathing can be, especially if you start taking more control over it and applying these principles. We have a lot more control over our health, and as a result of having more control over our breathing than we expect, than we can anticipate. But when you do these things and you see the results, it will change your belief system. It will change your approach, you know. And so this is why, one, we're having this session. This is why also why we want to bring this information to the community. And another example that I'll share with you that's really significant, that speaks to what's going on in our society today with this COVID-19. I want to just give some practical tips centered around that subject. Because, and I'll give you an example. A person by the name of, I'm going to put it in the chat so that way you can look it up as well for those who like to. And maybe some of you have heard this person before, but Semmelweis. Ignaz Semmelweis. He was a Hungarian physiologist. I'm going to put it in the chat now. Okay. So he was a Hungarian physiologist, and he and an obstetricianist, and he realized that back in the 1840s, that there was a significant amount of deaths occurring of women who were giving birth. 80% of these women who were not having their children at home, but having their births in the hospital, 80% of them were dying. And he proposed that it was as a result of doctors not washing their hands. They may have just maybe examined a dead body and then just wipe their hands and go and deliver a person, do a delivery. Well, that he was rejected because their perspective was it was as a result of dirty air, not taking the responsibility of it. It actually could be because of bacteria on the hands of the doctors. And so not only was he rejected, but he eventually was put into an asylum. Um, and But lo and behold, years later, and as we all know today, the importance of washing of hands, it wasn't until the 1940s that doctors started to, on a regular basis, wash their hands. Almost 100 years later, after Dr. Semmelweis was presenting and promoting the washing of hands for the health of his patients. When he did apply this, and here's the connection between Dr. Buteyko, when he did apply washing of hands, the death rate went from 80 to 20. And despite the results, the significant results that he was having, because of the belief system of the medical community, they still rejected his perspective, regardless of the results. What a shame, because from my perspective and what I'm seeing on my end with treating patients, and there are many doctors that are starting to become more and more aware of this, is a similar situation and circumstance. And that is, yes, the COVID-19 virus causes a significant, pneumonia, and as well, causes the body to react in a way that causes, a significant amount of pneumonia. And that's why patients are having a significant amount of breathing trouble. And now going from having uh, requiring oxygen to the point where they're on a ventilator, sure, maybe that has been started the domino effect. But once they're on a ventilator, what they're experiencing is about the same ratio of deaths. 80% of people who have COVID-19 that are, you know, digressing to the point where they need a ventilator, 80% of them are winding up dying, right? Now, how does that relate to the story? Well, what we're realizing, some are realizing, and these are the things that I'm trying to bring to the table as well, is that it's not the virus that's causing the deaths per se, but it's the mode of ventilation that we're using. It's the mode of ventilation, which is, the old traditional way is, high volume, um, blowing off, the CO2, and from Dr. Buteyko's perspective, hyperventilation. If hyperventilation can cause problems when you're well, imagine the kind of problems that it will occur when you're not well and on a ventilator. And especially with this COVID-19, it's really, people are not, have never experienced this before, the level of deaths and the level of complications. And once again, from my perspective, it's not the virus may have started, but it's what's causing the deaths is the mode of ventilation. Because when we do the opposite, here's the interesting thing. Just like with Semmelweis, when the mortality rate went from 80 to 20. Well, in units, that doctors that are attuned more to this concept, as far as maybe not because they know Buteyko, but because they also see what's occurring and want to do something different. In certain units in the hospital, we've seen where it's been reversed. Instead of those same patients who are on ventilators that have an 80% mortality rate, winds being 20% mortality rate. This is what I'm seeing in the hospital, which reinforced and supported the things that not only I'm sharing with you today, but for my own education as far as a advanced Buteyko specialist. The same principles that we're using to help promote people's health, we're seeing when it's not used, it's causing people's death who are ventilated and have COVID-19, who are positive for COVID-19. And when we use these principles of decreasing breathing, using smaller volumes, decreasing the frequency of the ventilator, because on a ventilator, basically the patient is at the mercy of whatever settings you set, because typically they are, totally out of it, unconscious. We're finding when we change these principles, the mortality rate goes from 80 to 20. And it may be counterintuitive, but the results are there. And I think it's important that, more and more people are addressing this, becoming more aware of this. And these are one of the things that, I wanted to also bring to the table. So that way, not only can you have this information and impact yourselves, but also, those who loved ones you may know, or if you have loved ones who are in the hospital, help them with this information. Share some of the basic principles of decreasing their breathing, relaxed breathing, taking a detox from the negative news that will cause stress and anxiety. These are just some basic, simple principles, but yet, because you're dealing with your breathing and the frequency of your breathing, you breathe every second of every moment of every day. Because of the frequency, that's why breathing, when you change, can have a significant impact. And so these are some of the things I wanted to share with you, some resources. In addition, as we move on, once again, we try to really pack these sessions out with as much information that maybe will be relevant to some and not relevant to others, but we want to cover our overall basis. At least provide something for everyone. Okay, so I'm sure you can see my screen now. One of the things that I shared with you is, once again, the meditation that's available. Some of the things, what can you do? Some resources to help you along in your journey in learning more. Because of time's sake, we couldn't cover. It's important to really take your own, be responsible enough to take this information, but then expand upon it. And we have some suggestions. One, when you go to the breathingcenter.com and you go to the home page, can everyone see my screen? Yes? All right. Go to the home page. You can look at breathing tests for free. You can do your own breathing tests. You click on breathing tests, and we have available a free report. So that way you can educate yourself on the principles that we're talking about, hyperventilation, on what's called understanding how to measure your breathing. So that way you can get an assessment of your own breathing where you are. And then towards the bottom, fill out the form and we will provide for you a free report. So that way it will help give you some indication as to your level where you are in your own state of health breathing wise. The other thing for today, for folks in our class, we offer a Buteyko bundle special, where we'll include the recordings, 8 hours of a video course for the map to Buteyko to healthy, perfect breathing and a health course. So that's included in this bundle is the Buteyko map, the Breathe to Heal book, download version. Normally the book itself costs $29, but we can give you a downloaded version along with this bundle, so that way you can understand the basics of the Buteyko method and how it can impact your health. In that book, you will see even a interview with a medical doctor talking about these principles and precepts. So that way you really can get some key information related to the breathing method. Also, I had mentioned earlier about the audio for meditation for helping to relax. Well, we're also going to include that in today's bundle, a downloaded version of that. So that way you can get that along with this bundle. So that's one option to continue your journey in educating yourself. The other option to help is one which will maximize your ability to implement these things, because it does take, when you're working with your breathing, you really want to work with a specialist. And so today, not only will you have the bundle, but you also can have a private session with myself. And this email will be sent to everyone who is on the course, on the call today, so that, or part of this course, so that way you can have these options. So shortly after our session, this will be emailed to each and every one of you. Last is another way to really maximize is do the full level 1 training. It's a private session that's done with myself, and where we can really match not only the method, but really take a look at your present situation and circumstance and coordinate the method around where you are in your health, whether it be advanced or not, or even if you've been exposed to Buteyko already, really drilling down into the method and the way we teach at the Breathing Center. And so those are things that, 3 options that you'll have available to yourself. For the bundle, it's only available until Monday at 5 p.m. The bundle is not available on the website. It's only through a private invitation through which, through the emails that you receive. So you have to utilize that. You won't find it on the Breathing Center because it's an exclusive offer to you guys. Also to you guys, we're offering on, if you decide to take the level 1, we're going to take $100 off the price. And what I also will do for those, fast action, quick start fast action bonus is within this email. These offers are available, and as far as, especially particularly the bundle, is available until a Monday. But within the next 24 hours, if you do decide to take the level 1 training course, out of my own pocket, I will take $100 additional and apply it to that package. But that's only exclusive to you guys for the next 24 hours. You will have to pay the price, and it will be reimbursed. You'll get a reimbursement because it literally will come out of my own pocket. And so you won't see that reflective on the email link, but you will be reimbursed an additional $100 for the next 24 hours as a gift, personally from me to everyone here for their time. So those are some of the options that you have. What I'd like to do is stop sharing and open it up to some questions for the rest of our time here and possible answers. I may not have all the answers that you're looking for. I may have some of the answers. So as being transparent, I'll do my best. But I do have some, experience utilizing these principles in the hospital as well as out. And so, Barbara, I see. Just raise your hand if you like to in the chat box.
I can't access the chat box.
Say
I had it. I
Barbara?
accessed it earlier, but I can't find it now.
We can hear you, so I just unmuted you.
Yeah. All I'm trying to do is, did you take the chat box away? Because I found it earlier, but I can't see it.
Oh,
I can't
click. If you just click on it, it should show up.
I don't see it. I don't see it. Oh wait, more. Nope. I've got a different menu with does not have a chat box anymore.
No problem,
I'll just say that.
Yeah, just tell us what do you need.
No, that's it. I just wanted to ask where my chat box was.
Oh, okay. So did you find it now by clicking on chat?
No, can't find it. I just want to know if anybody else has that problem.
No. Maybe if you click on participants, but no problem.
Oh, I see.
Okay.
I see that. Yes, I see it now.
All right.
Thank you.
You're welcome. Take care. All right. You're unmuted. Do you have a question?
Hi, I do.
Vive?
Yeah,
yes.
You were. Thank you.
Hey, Vive. Hi. How you doing? Thanks for joining us again.
Thank you so much for having this. Maybe 3 quick questions now. The first was, you mentioned an herb or an herbal supplement for those that were very congested. I just didn't get it to write it down. I just didn't.
No problem.
What was that?
It's called a Tricatu, and let's say in the email, we'll make sure that information is included. Say information related to that.
That would be wonderful.
I don't readily, okay. I'll see that that's provided as well. We'll do our best to do that.
I really appreciate it. I've never heard of that one.
No problem.
The other is, verbally, how, if ourselves, we may not be in a position to do it, but more if a loved one goes to the hospital and we can actually speak to someone. We are capable of getting to someone, which I know is hard as well because everyone's so slammed. When we want to talk to them about altering the plan, because you're not the first person you're not the first medical professional I've heard say, this isn't working the way that we're treating. So what verbally do we say to say we need smaller volume, we would like to request smaller volume, decrease the volume setting? Is there somewhere that they can go to say, hey, maybe you should look at this doctor's work, there seem to be having success? How do we direct that once that train starts? I just don't know how to stop the standard of care that is currently acceptable for COVID.
Great. Thanks for that comment. That's a key point. Very briefly, one, you got to realize once you're in the hospital, there is a limitation. We all know that. That's why we want to try to do what we can to avoid it in the first place. That's why we first and foremost talk about prevention. So that's the key component, that not even getting in that situation. But given that situation, when they're in the hospital before their health degenerates, I would share some of the key points that we shared today, about nasal breathing. This is what I've done. I have friends and family who have been in the hospital, and I have a conversation. Hey, focus on These are things that anyone can do, regardless of what institution they're in. They have control over decreasing their breathing, relaxing their breathing, nasal breathing in and out, laying on their chest, at times, or sleeping that way to help, especially at night, decreasing the breathing and helping some control. So these are things that I would share with them before they get to that point. But once they're, on a ventilator, they're really being managed by the doctor. And one thing that you can do on the breathing website, breathingcenter.com, if you click on COVID, there is an article by Dr. Novogilov, who wrote about the damaging effects of ventilator management. That's something that you can give to them. And once again, it's not a guarantee, but at least it provides, they are hearing from a doctor, and it may be trigger something for them, because oftentimes if you tell them, they look at you as a very lay person, even if you have, some of the results. Even myself, when I talk to doctors, I have to fashion it in a way, in the language that they can understand, right? So I don't talk about hyperventilation. I talk more about decreasing the pressure, terms like permissive hypercapnia, terms like decreasing the PEEP. These are things that are within their scope that they all readily accept. But if I start speaking about, hyperventilation and what, their view of hyperventilation is entirely different than the view of Dr. Buteyko as far as the application of it. So I understand, being on both sides, why they would have a conniption if you talk about hyperventilation and how it relates to health. And they literally will look at you as, you don't know what you're talking about. I understand, because I'm on both sides of the fence. So that's what I do. I try to fashion my words and things in ways that they already understand, but also provide some literature from someone that maybe in their eyes they'll look at as more credible to help support what you're trying to convey. That would be the best case scenario, and hopefully, prayerfully, you're in an institution where doctors are more open to that, and cookie cutter, hey, we've done this way, and a study that we look at how to manage RDS from 20 years ago, even though it's not working, they're still gonna go that route. Hopefully you're not dealing with that type of medical doctor, whereas they're more open, or looking for, because what they're not working, because what they're doing is not working, they're will be open to alternatives or consider some things. That's my best how to best address that. Does that help?
Yes, thank you.
Okay,
And
you're
kind of
welcome.
what I was thinking. And last thing, is it $100 when you click the link off the course?
Yes.
And then you're going to take an additional 100, so it's
Correct.
really 200 off?
You got it.
Well, I might be clicking.
That's my gift to you. That's my gift to you. But once again, that you will be reimbursed, because that's not built into the system. They don't even know. They don't even know I was going to do that. So they may even lock me up a couple of days for doing so. So we'll see. All right.
I would like to ask you a question.
Yes. Who's?
Linda. It's Linda.
Okay.
Yeah.
Okay. Go ahead. Shoot.
And
then next we'll go to Tight, and then Ruven. I'm sorry if I don't pronounce it correctly. English is just my first language. I don't know. Go ahead, Linda.
All right. 2 questions. I haven't heard you talk about sleep.
Yes.
So much, but sleep's really important in my life. And I spoke with the nurse who teaches Buteyko in Dublin, Ireland.
Sure.
She says, I never had asthma. I also have asthma. She said, but I studied Buteyko because my rounds are changed a lot and my sleep was really wrecked. And so that's one question is, I never knew that you could take Buteyko just to change your sleep. The other part is, asthma medications have been very harsh on me, and I was advised for years to take asthma medications just before I go to bed so that I nip a nocturnal asthma attack. Here's what happened. It messed up my deep restorative sleep pattern.
Yes.
And it's still not corrected, and I still have asthma, but here I am hoping that I can learn more and maybe get the training I've always wanted.
Right. Absolutely. Well, great. Thanks for bringing that to the table. And you're absolutely right. It has a significant impact on sleep. In fact, I don't have asthma, but one of the reasons why I pursued becoming a specialist, in addition to my background, is because that's the one thing that it helped for me. It helped significantly improve my sleep, where now I'm able to get more rested sleep, more efficient sleep in less time. So it pretty much knocked off about 2 hours for my sleeping pattern, where I get up, not with an alarm clock, I get up naturally, but really 2 hours less than I used to. I used to be a 7-hour type of person. Now I'm a 5-hour type of person as a result of my training. And that's the one thing that for me, it had a significant impact. And that is the very thing, my sleep. It's more efficient, more effective, and less. And so I'm able to do more. And so it pays off in multiple levels, multiple dividends, when you really start to learn how to address your breathing and get the information that you do. Not only when you don't have symptoms, but in your case as well, it will significantly help your sleeping as well as your asthma. Those are our number one patients that notice the most immediate improvement, those who have sleeping issues and those who have asthma. But with yourself, I would highly recommend is to do the level 1 training, so that way we can really work with you closely, because it does take detailed work, and it will be well worth the time as well as the finances that you put into it. Thank you. Let's go to next.
Yes, hello.
Tate? Yes.
From Italy, yes. Yes, I'd just like to know the name. I didn't get the name of that doctor that found out the importance of washing hands.
Oh, it's in the, I'll put it in the chat. Do you have the chat box?
Yes.
All right, I'll put that
Thank you.
in the chat box again. But it's Semmelweis. I'll spell it because I don't see it right now. Ignaz, I-G-N-A-Z, Ignaz, at least that's the way I say it. I could be slightly wrong, but I think it's Ignaz, I-G-N-A-Z, Semmelweis. That's S-E-M-M-E-T-W-E-I-S. And he was a Hungarian physiologist. Thank you.
Thank you.
Welcome. So Raven, we have next. Ravan. Okay. You can speak.
Julia?
Mm-hmm.
Okay. So a few questions.
Reuven.
Yes, a few questions. One, how do you breathe deep? I mean, you explained how to, breathe in and out through the nose, to relax, but what is it? How do you actually get it to go deep?
Wonderful question.
You can ask, you want all my questions or one at a time?
One at a time.
Okay.
Breathing deep is not big, right? And not noisy, but breathing deep is just breathing into the abdomen so that when you're breathing, your abdomen just moves out a little bit. You know, you feel an expanse in your lower area. So it's more or less you're focusing on not just shallow breathing, like just up in the chest area here, but focusing your attention more on your, say, just right above your stomach. That's your abdominal area. And you just, when you breathe, you notice that that's moving in and out, you know, slightly, opposed to, right? If you can see the difference. Opposed to this, which is upper, it's more lower. So notice my chest, upper chest is not moving, but you can see my hand. So it's just a matter of where you're placing your focus and your emphasis, and you should see a little slight movement in your abdominal area, not big, which will promote a big breath. Does that help?
Yeah.
Okay. And like I said, anything new takes practice. You may not get it right away, but it's the frequency that will bring about familiarity.
Okay.
Excellent.
Second question is, you spoke about the discounts for the level 1 training, but what's the cost?
Okay, the cost, let me show you. And you will have this in your email. You will get this. So, okay, so this is the cost for the level 1 training.
Mm-hmm.
And that's with $100 off. And like I said, so an additional, for me, within the next 24 hours, it'll be $14.75.
Mm-hmm.
But you will be reimbursed
Mm-hmm.
the 100. Okay, great question.
I must say that kind of do it right away, buy it now or never is adding to my stress level.
Well, it's a great opportunity to practice the basic principles of relaxing and breathing.
Good sales.
But and once again, it's not a now or never. You can always get it, but we want to offer a quick action incentive. But thank you.
Sure, thank you.
You're welcome. You're raising your hand, Julia.
Okay. Can you hear me?
Okay. Go ahead, Julia.
Yeah.
Yes.
Yes, I just want to tell you that I signed up this morning, so I'm going to be taking the training with you.
Wonderful. I'm looking forward to it.
Yeah,
Thank you.
I had so many things that I think that this is what I'm looking for that will help me.
Mm-hmm.
So,
excellent.
Okay.
Looking forward. Thank you so much. And thank you for your support. I'm looking forward to helping you.
Okay.
This is, you know, things that I'm really passionate about. Excellent. Now we have Amin.
Hi, yeah, Armine, thanks for the presentation.
You're welcome.
I have a question. It's not just COVID related, but the cough, that spasmic cough that I haven't yet figured out. Is it due to allergies when it's outside or dusty or food? I'm not sure. But then the cough attack comes. And I was wondering if Buteyko has a suggestion when the like cough, like I was biking the other day with my kids, my husband, and I noticed dust around me, and I started, like, it got so like scary, like tense, and couldn't stop the cough. So is Buteyko, does he have an emergency response to it?
Okay. Well, one of the things, you know, is that we don't treat a specific, like when we talk about asthma, or we don't really treat, we're not medical doctors, so we don't treat these things. What we do is we provide you the information and provide the training and exercises to help you maximize your own health so your body can address its own health challenges. With that said, it doesn't matter what the cough is from. If your overall system is much more improved, the principle is it will address whatever, whether it's allergies or what have you. In this method, we have found that, believe it or not, and once again, it's that's oftentimes what stops a person from moving forward. It's their own belief system, right? Because they've been told that, say they're not going to be able to improve if they have, say, sleep apnea. You know, maybe they've been told by their doctor they're dependent on the sleep apnea machine, or that they're allergic to cats and they can never expect any improvement. Because you've been bombarded with that information, oftentimes that stops people from doing anything. But we're here to tell you that we have folks who have experienced even changing their allergies. And it doesn't matter whether it's food allergies, allergic to cats. There are people who, when applying these principles, the same principles, whether we're addressing, you know, asthma and wheezing, to people who have allergies to various things, once you get your level up and your control pause up, we talk about that in the training. There have been people who have been allergic to cats for their entire lives. And then all of a sudden they can be around cats and not react. So this is the things when we say breathing has a significant impact on one's health, we really mean it has the potential of having a significant impact, but you will only know until you push past your belief system and try these things and apply these things. And so this is why we're offering various levels, so that way, depending on your budget, depending on your time, and depending on really your belief system, you can utilize the Buteyko method and learn the Buteyko method at your comfort level. And so that's why we wanted to not only have this session, but also offer 3 different options for you to be able to get the information that you need. And maybe you start with the test and then go from there. Or maybe you start with the Buteyko map, or reading the book, getting a little understanding, grasping what you do know, applying some principles. If that's where you budget-wise that you're able to handle, then we go there. But the best case scenario to get the quickest results and maximize the results is the level 1 training. But that's entirely up to you.
And the private sessions are like, are they going to teach something that's taught on level 1?
Yes. Yes. It's almost like instead of having the whole session mapped out, the private sessions we do one at a time based on one's level. The private session is $111 per hour. The only difference with the private sessions, which can be significantly and key, is that you don't have the email support. With the full training, we also provide unlimited email support throughout the entire course and thereafterwards, right? But with the private sessions, you just have the private sessions where we will be teaching the concepts from level 1, but at a cookie cutter pace. You know, each session, we cover what we can cover.
Yeah, so how many private sessions would be needed in general to get level 2, level 1 teachings? Like,
I would say close to about 10, right? Close to about, because it's a little less and you don't have the email support. So it's a better value of the full, but whatever level of comfortability time-wise, because it is a greater commitment, because you're committing to the 8 weeks, or you can break it up. It's entirely up to you.
Thank you.
You're welcome. Good question. Thank you. I will unmute you, okay? I will. I'm sorry, mute you. Anyone else?
Hello.
Okay, yes.
Me, Sherry?
Linda is listed as Linda Howe? Yeah, okay.
It occurs to me when you were talking about if your immune system and your health gets stronger, then your body can tolerate or handle more like a cat or dust or something like that. And I've been living in an apartment for 5 years that's very close to the road. So there's certain hours that I get exhaust from vehicles. And then there's a laundry room underneath my building where the laundry stuff, the smells from the laundromat come into a air conditioner or come into my bedroom. And it gets me gagging. And people can do their laundry at 3 in the morning. And I'm thinking, would I need to just move away from here before I would sign up for a training? Because look at the factors that are impacting me. It's almost like, how do I really hope to see a change when my environmental factors are so rampant? And I have a cat. Like, oh, let's throw the cat in. I love the cat. But, and my health has gotten worse living here. So I have an intention to move, but now with this offer, I'm hesitating because, and in the past I've hesitated because the winters are hard, really hard. And I'm going, wow, do I move to just a warmer climate? Drier. I'm kind of really challenged to know what the timing would be right as I get older. I just turned 20, so I'm like, wow.
Good. And that's one of the things, actually, Barbara, who was attending, that's one of the things I shared with her during our session just this past week. And I shared with her that, because she was ready to move. And I shared with her, you can always move, but you can't unmove. And so my perception is it's best to do everything that you can to, address the issues, especially if it's because of health related, before just uprooting your life, because that's going to be, much more significant impact. So why not do what you can do to avoid the move, and that this is a method of a way that can help, really address and minimize the impact of the environment where you are, if you so choose, opposed to, just uprooting your life and just changing the environment. Because either way, whether you're here or there, you still have to address your breathing.
Right.
So why not do it before?
I wanted to
then
give
move
myself
forward.
the best chance to succeed.
Exactly.
Right.
Yeah, and that's also another approach, making it easier. But I would say, either way, wherever you are, you can you will receive benefits from the situation and circumstance.
Thanks so much for your presentation.
Oh, my pleasure. And thank you for your support and your time. And anyone else, raise your hand in the chat box, because I don't see everyone. So I can't see you physically raising your hand. But if you click participation and then hit raise hand, then I'll be able to see it. And no matter where you are positioned in our section, you'll be able to ask your question. So I don't mean physically raising your hand, but raising your hand through clicking participation, and then that would be the best way. Anyone else have a question? Okay, we have Sherry. I will unmute you. Okay, Sherry.
Yes, hi. I wanted to say that I can say I've already started doing a lot of what you've been advocating, namely nasal breathing, and been doing this for a while, even before I joined your session.
Sure.
And I noticed right away that I was not breathing through my nose and, like I should. And once I became aware of that, I fixed that pretty much for waking hours. And I felt much better and had more energy, etc.
Sure.
And then I started addressing my night sleep, because I have a mild case of sleep apnea.
Right.
I'm doing what I learned in Sasha's book, Breathe to Heal, to tape my mouth, which was hard to get my mind around.
Right,
And
right.
actually do it. And boy, that really helped.
Mm-hmm.
And at night, taping them out.
Yes.
How bizarre can you be? You feel like, wow, this is really going off the deep end. But I really found that really helped.
Sure.
And I've only done that for a few nights, but so far. So I just thought for people who are wondering, you can start doing these simple things and you'll see right away that it does affect you.
Sure.
So,
and you,
sorry.
Go ahead. I didn't
Well,
mean to.
and the other thing is in this map for life, and I already bought it actually this morning without the bundle. And does that help much with apnea particularly, or is it address more that problem?
So great question. So everything that you teach at whatever level will be helpful. The issue is that whatever the way to maximize and get the quickest benefits is to have that one-on-one personal instruction, because unfortunately what I've found is that you can read some information and apply it, but a lot of times you will apply it in a way that may not maximize the benefits.
Yes.
But something is better than nothing, as you already have demonstrated. Just by applying some of the principles, you get some of the benefit. But when I work with individuals individually, I'm just sharing is that's when you can really dial down and see specifically how you're applying it, and then share with you, okay, give you the confirmation, yes, that's the way, or there's some slight adjustments that can be made. And so that's the key difference between the map or a book, is that it's really important. And with your breathing, subtle differences can make a significant impact. So,
well,
be mindful.
I have not bought the whole package yet, because actually I've been to over 100 doctors, maybe, I don't know, 120. I went to the Mayo Clinic for 14 days. When I initially got sick with sleep apnea, I thought, I'm not going to live with this. And so I talked to all kinds of doctors and paid all kinds of money to see. They had I started back in 2008. They had no suggestion and nothing that helped. I went on the CPAP. That was like terrible, forcing air down your throat. It did help, but the price you had to pay to wear a mask and have air forced down your throat and look like and feel like Darth Vader was not quite what I wanted to do for the rest of my life. So really, up until finding out about your Buteyko method, I've helped by exercising my whole self. I did that for the last, I don't know how many years. But this is the only thing that I found that did anything to help me.
Excellent. Yes.
Diet, I have nothing too crazy, but just no gluten, for instance, and not heavyweight. I exercise very nicely at a senior center, and that helps. But the doctors helps, and they're not really that interested in helping.
Okay. Well, I appreciate what you shared, and that is true. And in the sessions, continue to learn what you need to learn, and you brought some excellent things. These are little things in addition to, like I said, our time is so limited, but we tried to pack it out, provide what you can utilize now, and in the information, it will continue to provide, to give you some additional points. So continue pursuing your health and this journey. We're going to take one last question, because we do have to close out and be mindful of other people's time here. So Kathy, I see that's the last hand that's raised. And so we will Go ahead, Kathy. One
All
final
right.
question.
Yeah, mine is related to the sleep issue. I have a chronic lung infection that was diagnosed about a year ago. I've probably had it before. It's called NTM-MAC, which stands for non-tuberculosis mycobacteria.
Mm-hmm.
And the MAC is the type of bacteria, the type of mycobacteria. Anyway, it's a weird disease. It's fairly rare. It affects a lot of women. But I'm not going to go into the medical side of it.
Sure.
I think the Buteyko could help. The treatment is years of antibiotics, which I'm trying to avoid.
Mm-hmm.
But in the meantime, I'm doing some of the things I've noticed I'm doing wrong, like working on the mouth breathing, and around the sleep issue, I am having the hardest time conforming to the request for instance, not mouth breathing. I didn't know about taping the mouth. That sounds a little strange to me, but anyway, like I wake up and I'm parched. My mouth is up, open. My teeth are even like I'm like glued. You know, it just and it feels terrible.
Yeah.
And I don't know how to stop myself from mouth breathing, because when you're asleep, you're asleep. You don't know what your body's doing. The same thing with trying the prone position. My body I just move wherever it wants to go. And so that's the problem with sleeping. So do you have any suggestions? And
Yes.
my mouth, taping my mouth? Go ahead.
Let's shoot directly to that. In our training, we cover some of those materials to help you incorporate these things. We always recommend incorporating them not right at night, but start first during the day, so that way your body can get used to it. Two things that you can think about doing is not only the tape, but there's another way they actually have products on the market that address this very issue. And I'll just show you, I don't know if you see this here.
Yeah, I can see it.
Somniflex, right? This is,
I've never heard of it.
yes. So you can look it up on the internet. And this is a product that's for nighttime sleeping to tape the mouth.
Oh.
So if you don't use regular tape, this I find to be more efficient, all right? So with that, we're going to end. And these are just some ideas that you can apply. But I want to thank everyone for coming and taking the time, and hopefully you got some value out of these sessions. Okay?
Thank you.
Take care. Bye-bye.
Bye-bye.